After reading issues of professional integrity, case number 2, I pretty much got that the situation that this clinic is dealing with is that the patient that belongs to an insurance that lowered the reimbursement rates are beginning to attend the clinic due to lack of availability. The other clinics are accepting them at. This insurance is called White Rose Insurance. The changes were made and due to the lower reimbursement rates, changes were made to the specific clinic to group the patients that belong to that White Rose Insurance and only allow there to be a set appointment times between the times of 1 and 3 p.m. Essentially, a patient approaches the office manager and informs them that they're not able to attend their sessions at the given time after attending for a certain amount of period, but the head PT is not being accommodated to certain patient circumstances. They proceed to then still try to attend the appointments at that specific time, but come back after the second week and mention that it's conflicting with their job. This is an example of an ethical temptation or distress due to knowing what the right thing to do, but the PT not actually wanting to do it. So using the RIPS model, the primary realm involved in the situation is the head PT of the clinic and the patient that is looking to have the work and therapy schedule accommodated. A patient trying to accommodate, but the clinic is not willing to have a patient with White Rose Insurance be scheduled alone outside of the 1 to 3 time frame due to compensation losses and low reimbursement rates. So using the moral principles and rules, the PT duty, responsibility, integrity, and veracity are conflicting with this situation. The physical therapist is not being honest with the situation and his employees. He's not being honest with the overall situation to clients and patients, and to his employees, that even the PT working at the clinic is confused. The duty and responsibility the main PT have in accommodating patients with their schedule is conflicting with the situation because they do not want to lose money being scheduled outside of the group 1 to 3 p.m. Therapy. For veracity is being questioned as well because honesty between the clinic and the patient is not being valued. Standard number 2 conflicts with the situation due to needs of patient and clients not being met. Due to the needs of the patients not being met and not necessarily being addressed by the physical therapist, by the main physical therapist. The right thing to do would be to accommodate the patient and his needs. He is intending the clinic for his needs of getting better and to go back to work. And had already worked with the schedule of the clinic by leaving work for therapy, but the clinic does not want to work with what he can do just because the main PT wants to maximize the clinic earnings by grouping every patient with the insurance of White Rose altogether from the hours of 1 to 3 p.m. Clinics and physical therapists should address the needs of patients, especially if they are simply not able to attend their appointment due to work and therapy schedule conflicts.